Would a brow lift give me more eyelid show and fix droopy Botox brows? I have always had an angry and heavy brow look, and after years of Botox and extreme aging due to stress, I look so unpleasant. Please help. I am so desperate.
Thank you for your question. You're asking if a brow lift will show more of your eyelid and fix drooping Botox brows. And further in your question, you state that you've always had an angry look to your brows and you've been using Botox for many years and you've had a lot of stress, and so you're looking for solutions, and you actually submitted very good photos where you show your brows at rest and then with your brows raised. Well, I can certainly give you my perspective on this type of question from people who I treat like you in my practice. A little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I have a long history of helping people with eyebrows. This is a big part of oculofacial plastic surgery, and this is an area that has some spectrum in what different doctors feel about what is the aesthetic eyebrow. So I'll give you my perspective based on the photos you submitted. So understanding that you can pretty much tell a significant effect that brows have on the impression that a face makes when someone looks at them. When you want to draw anything, if you make the eyebrows in one shape or another, you really can affect what is the emotional impact of that face. So when I was first in practice, I was particularly impressed how a lot of my colleagues liked to make brows very high and arched. And I always thought that made people look very, very surprised. And so I feel that it is it's important to maintain a natural look, but I think you're on the right track as far as the position of the eyebrow and creating an angry look. I think one significant element that is probably treatable without surgery is how the Botox is being applied. When you talk about drooping from the Botox, well, it's because you're also treating the whole forehead in a way that is causing the muscle called the frontalis muscle. This is a muscle that lifts the eyebrow. There are basically two sets of muscles that affect eyebrow position. They're called eyebrow elevators, eyebrow depressors. The eyebrow elevator, that is the only one that matters, is called the frontalis muscle, and that vertically lifts the eyebrows. Unfortunately, it's also responsible for horizontal lines in the forehead. The eyebrow depressors are the corrugator procerus muscle and the orbicularis oculi muscle. Now, these are not names that you need to necessarily know, but understand that those muscles work together to cause the eyebrows to go downward. And they also affect the direction from side to side that the eyebrows actually position. So when people want to come and have Botox, or what's called a Botox brow lift, I will typically proportionally relax the eyebrow depressors and only partially relax the eyebrow elevators. And the point of only partially relaxing the eyebrow elevators is two things. One is to address the desire to improve the horizontal lines, and two is to avoid the overarching, often referred to as the Spock appearance of eyebrows when there's no opposition to those muscles. Now, that being said, you can consider limited surgical brow lifting options, but I think that there is a challenge to that. There's a technique of doing limited fixation of the brow so that you get a certain shape without doing more traditional endoscopic brow lifting surgery. But understand that, again, you have to be really clear on what your optimal eyebrow position would be. And with more traditional brow lifting surgery, that's very, very difficult. Now, there are different methods to do brow lifting procedures that can be customized, but there's always a little bit of elasticity to that, in that the eyebrow position doesn't always land exactly where you want it to be. You can get improvement, but you have to be clear about what your final outcome, desired outcome is. So I think you should discuss this with your doctor who performs your Botox and think about ways that you want your eyebrow to be shaped. But I think personally that the photo you showed where the eyebrow is really high, yes, it'll show more eyelid, but at the cost of you looking perpetually surprised, which I would advise against. So I hope that was helpful. I wish you the best of luck, and thank you for your question.